buccinator muscle.
Mhm,
It can be divided into five groups. The five groups include of the epicranial muscles. The epicranial muscles include of occipitofrontalis, temporoparaetilis. The eye muscle and surrounding area consist of orbicularis oculi and corrugator supercilii.
mhm,
Muscles of the ear consist of anterior, posterior, and superior auricularis muscle.
mhm,
Muscles of the nose consist of nasalis, depressor septa nasi, and procerus
mhm,
muscle. And muscles of the mouth, and let's start with generally. It is orbicularis oris and then buccinator.
mhm,
And then it can be subdivided into two, which is the upper area and lower area.
mhm,
Upper area controls the upper lip, which is these muscles are levator labii superioris,
mhm,
levator labii superioris alachinasi, levator anguli oris, zygomatic major and minor.
mhm,
Now the lower area consists of depressor anguli oris, depressor labii inferioris, mentalis, and it is okay. Yeah, all of these muscles are done. Now I'm going to be talking about innervation, vascularization, and drainage.
mhm,
Vascularization is done by facial artery, drainage is done by facial vein,
mhm.
and innervation is done by facial nerve.
Okay. All right. So that's the first one. All right. Can you repeat that again, please?
The facial muscles. The facial muscles are flat skeletal muscles that are located underneath the face and the scalp. Uh, they are not covered by any fascia except the buccinator muscle. It can be divided into five groups. The five groups includes of epicranial muscles, which is the occipitofrontalis and temporoparaetilis. The muscles of the eye and its surrounding area consist of orbicularis oculi and corrugator supercilii.
Mhm,
And the muscles of the ear consist of anterior, posterior, and superior auricularis muscle.
mhm,
The muscles of the nose consist of nasalis, depressor septa nasi, and procerus.
mhm,
Muscles of the mouth, generally they consist of buccinator and orbicularis oculi. No, sorry, orbicularis oris.
mhm,
Now it can be subdivided into upper area and lower area. The upper area controls the upper lip, lower area controls the lower lip.
mhm,
Uh, area muscles consist of levator labii superioris, levator labii superioris alacine nasi,
mhm.
levator anguli oris, zygomatic major and minor, and rizoris muscle. The lower area consists of depressor anguli oris, depressor labii inferioris, and mentalis.
Okay.
Now I'm going to be talking about the innervation. Innervation is done by facial nerve. Drainage is done by facial artery, and wait, yeah, vascularization is done by facial artery, and drainage is done by facial vein.
Okay. One more time, please.
Yeah. It is flat skeletal muscles that are located underneath the face and the scalp. It's not covered by any fascia except the buccinator muscle. It can be divided into five groups. The five groups consist of epicranial muscles, which is the occipitofrontalis, temporoparaetilis. The second group is eye muscle and its surrounding areas, which consist of orbicularis oculi and corrugator supercilii.
Mhm,
The muscles of the ear consist of anterior, posterior, and superior auricularis muscle.
mhm,
Muscle of the mouth,
mhm,
yeah. Muscle of the mouth generally consist of orbicularis oris and then buccinators. Muscles of the mouth can be also subdivided into two. The upper area and lower area. Upper area controls the upper lip, lower area controls the lower lip. The upper area muscles consist of levator anguli oris, levator labii superioris, levator labii superioris alachinase, levator anguli oris, zygomatic major and minor, and rizoris muscle.
mhm.
Lower area consists of depressor anguli oris, depressor labii inferioris, and mentalis. Its innervation is done by facial nerve, drainage is done by facial vein, and vascularization is done by facial artery.
Okay, so I have a couple comments. First, what are the epicranial muscles?
Occipitofrontalis and temporoparaetilis.
So you have occipitofrontalis. I know what you're talking about. Okay, good. And I have another comment. You said What's this muscle again here? You said depressor anguli oris, depressor labial inferioris, and what's this?
Mentalis.
Yes, that's a mentalis. And then what about the nasal group? How many muscles are there?
Nasalis, depressor septa nasi, procerus. You can
Hmm.
also say levator septa nasi.
I have this one here, alar nasal.
Oh,
Yes. So that's the fourth that I know. Okay. All
okay.
right. What else do you know about the uh origins and insertions? Do you know maybe like if I say origins and insertions, like can you tell me a little bit in each group?
Somewhat, but not exactly. I don't know the origin and social
Yes,
about those stuff.
we need to bro memorize a little bit of these. I advise you to memorize all the origin insertions of the oral side.
Okay.
This is because like I could be doing this to you right now. You're telling me all of that, and then I tell you, can you tell me origins insertions? And that's the best for both of us, you know. And
Okay.
if you don't know that, then it's a risk. You understand?
Yeah.
Okay. So now tell me what's the next topic you want to talk about?
Muscles of mastication and suprahyoid muscles.
Muscles of mastication and suprahyoid. Okay,
Suprahyoid.
go ahead.
Muscles of mastication. They consist of four muscles and they assist the temporomandibular joint. Its function is elevation, depression, protraction, and retraction of the mandible. They consist of temporalis, masseter, lateral pterygoid, and medial pterygoid. Temporalis origin is at temporal fossa. Insertion is coronoid process of the mandible. Its function is elevation of the mandible, and it is innervated by mandibular branch of the trigeminal. Masseter, it consists of superficial and deep head.
Mhm,
They both have the same origin and insertion. So it's the zygomatic arch and bone, and it inserts into angle of mandible.
mhm,
Function is elevation, adduction, and protrusion of mandible, innervated by masseteric nerve.
mhm,
Lateral pterygoid consists of a superior inferior head. The superior head originates at greater wing of sphenoid and inserts into articular disc of temporomandibular. The inferior head, it originates a lateral pterygoid plate and inserts into the condylar process. Its function is protraction of the mandible. Innervation is done by mandibular nerve.
mhm.
Medial pterygoid consists of superior and deep head. Uh, its origin is the medial surface of lateral pterygoid and palatine bone,
Sorry,
and inserts into
medial pterygoid consists of what?
superior and deep head
Superior.
and deep head.
So how superior and deep? You want to say superficial and deep, right?
Oh, sorry, yeah, superficial and deep.
Yes, that's the medial pterygoid. You said earlier
Yeah,
superior inferior. Superior inferior is in what muscle? Lateral pterygoid.
sorry, yeah. I got confused with lateral and
Okay, go
superior.
ahead.
Its origin is medial pterygoid. Its origin is on the medial surface of lateral pterygoid
Hmm.
and palatine bone.
Hmm.
Insertion is at the medial surface of the angle of mandible.
Hmm.
Its function is elevation, protraction of the mandible, and it is innervated by the trigeminal nerve.